Hello everyone, this is Dr. Vivek Loomba here. I am a pain physician. I work at the Indian Spinal Injuries Centre, Vasant Kunj, New Delhi. Today we are going to discuss about the occurrence of chest pain with special reference to the post-COVID scenario. We will talk if it's a new pandemic in the present world. Now, as we all know that the COVID epidemic is at the fag end, and it is no longer the beast what it used to be, and it is no longer creating the havoc that it has done when it was the peak of the epidemic. However, the post-COVID complications and the sequelae of this disease continue to manifest, and we are seeing a large number of patients who are coming with the post-COVID complications. Some of these complications are very trivial. However, a few of them are very grave and actually life-threatening. One such serious complication is the occurrence of chest pain. The patients who are presenting to hospitals with chest pain have been ever increasing, and the numbers are not getting down. So much so that some physicians are beginning to feel if the chest pain is the new pandemic. The patients who are presenting with this symptom, usually most of them had a moderate to a severe COVID infection, and they have subsequently recovered. However, a few of them did have only minor symptoms, and very few of them did not even visit a hospital for the coronavirus infection. So why are the patients getting the chest pain? There are three big factors. Now, as we know, the chest pain can rise from the heart, lungs, or the chest wall. So the factors are pretty much the same. So the biggest factor is the heart muscle. Now the heart is the most vital organ of our body. What happens is after the COVID infection, there's been some injury, some inflammation in the heart muscle itself. Sometimes there can be blood clots in one of the heart vessels, which lead to obstruction of blood flow. Now, these things can result in a sudden cardiac death, and these patients may suddenly die without any premonitory and any warning symptoms. The second common cause of the chest pain has to do with the lungs. Now, as we know, the lungs were one of the most common organs to be infested by the coronavirus. What happens is that in some patients, the lung damage continues to persist, and gradually the symptoms may become very severe, and occasionally, especially if there's another infection on top of the pre-existing infection, this disease may worsen. So these patients may have a decreasing oxygen levels, resulting in ICU admissions and ventilatory support, and they may eventually die. The third cause of chest pain has to do with the musculoskeletal system, that is the muscles and the bones of the chest cavity. So that includes the ribs and the muscles there. Now, fortunately, this is not as serious a complication as the first two, namely the heart and the lungs. So what happens in this one is that the patients feel nagging pain, which may be constant, and it may worsen with any sort of activity, including simple tasks like getting up from laying position, or a small walk in the park, or lifting a small weight. So so they may have this constant nagging pain in the chest. What to do when you have these symptoms? My request to all of you is please do not ignore such symptoms. Please visit your doctor. Go to your hospital, see your doctor, get yourself investigated and treated if you ever have such symptoms. We'll discuss more about the treatment options and various modalities of treatment in the next talk. Thank you. Have a good day. Bye-bye.